obviously many older patients, and we've talked about exercise, we've talked about stuff that one can do to help in terms with arthritis, but now it's more of a mental health issue, and we're going to turn now to the elderly and how they can experience dementia. It's an acute mental status change. Can you talk to us a little bit about that and what patients experience?
Yeah, so dementia, truthfully, we start to see signs kind of chronically. And it may be little things that you notice in your family members. Maybe they're just forgetting tasks, maybe they forget your cell phone number, just little things like that. But the problem is it can rapidly progress in some people. Other people, it's a long, slow road that they, over time, get much worse. But dementia really can affect the person and the family, and it's kind of like you're watching someone you used to know just kind of become a different person.
But when do you have that moment where you say, okay, this could be a problem? Because a lot of us will say, well, I forgot where I left my glasses.
Sure.
Or, you know, what did I eat last night? But it happens to me.
Yeah.
It happens to you out there probably.
Yeah.
So when does someone know that, okay, well, this is going a little further?
Yeah, so I think one thing is look for the pattern. I mean, it's normal that you forget things, but is it happening more often? Is it happening more frequently? Those might be symptoms of Alzheimer's. Also, one thing you were pointing out about the acute change. An acute change can be very different. An acute change most likely is not going to be dementia. One thing it can be is infections in the elderly, urinary tract infections, pneumonia. They can all kind of present with just confusion. And a lot of times elderly patients don't have fevers and they're not able to describe their symptoms. So they may have a really severe infection and may present to the hospital just a little bit confused, more confused than normal.
So that can be confusion, disorientation, but maybe not what people don't want to see happening to their loved ones, which is dementia and Alzheimer's, correct?
It could be just completely reversible, to be quite honest. Other times it can be a sign that dementia is looming. If you present to the hospital and your symptoms of an infection or confusion, that might just mean that dementia is kind of creeping in.